Here I am again running. Today I did 4.4 kilometers in 23 minutes, which looks like it is 5.11 minutes per kilometer. And last time I did 3.5 in 18.3 minutes, and that was like 5:17 per kilometer. So I guess I broke two personal records. The first one is the pace, I did it a little bit faster, and the second one is that I did a full kilometer more. So super excited. Oh my gosh, these things are so insane. I think some important information is that my left hip is hurting. Not really badly and not in the groin area, which I think is the most important thing, because I feel like the main symptom of darkness is the groin area. It's pain a little bit like here, like in this part down. It just started hurting when I stopped running. I just finished my 5K run. It's actually 5.2 kilometers. And I'm very excited. It's really cool to see how my body keeps improving. I haven't seen the pace yet, but I think it was a pretty good pace because I felt like I was going fast. And this was after the day that I started spinning. And last night, after my skating class, I had some discomfort in my left hip. That's the non-surgical one. And today, I think after minute 20 or something like that, my left foot started hurting, and then the knee, and then the hip. So now I have pain throughout the whole leg in the left one, the one that didn't have surgery. The other one is actually chilling, it's doing good, so I'm happy for that, but I am definitely a little bit concerned about the other side.
And on Monday, I still went to the gym and I did my normal PT at home lifting routine. And then my left hip started hurting. Tuesday, Wednesday, Thursday, I was still sick. And I thought that maybe because I was sick, because when you have these viruses, the whole body is in pain. Like you have so many aches and everything is like swollen. So I was thinking that maybe because I was sick, I was feeling this pain. I wasn't really sure what was going on, but I kept it together until Thursday, I guess probably in the afternoon, where my lower back started hurting, and then my knee would hurt, and then my heel would hurt as well. All of this in the left side, that is the non-surgical side. And then on Friday, the whole thing hurt. My whole leg was hurting and I lost it. You know, I went down the rabbit hole, back to imagining the crutches. I had this flashback of everything that I've done throughout the recovery process, and I was very scared. I was in despair. I texted a friend who is also recovering from a hip condition, and she was trying to soothe me, asking me not to go there, but it's really difficult not to when you have pain for so long, and also you know that there is an underlying condition in there. Ironically enough, Saturday I had a break of the pain. I didn't feel pain there. My other hip was hurting, but if that one hurts, I know that it's for a reason. So Sunday, I had the pain again in the left hip. I flew, so on Monday, I had pain in both hips. And that takes us to Tuesday, which was yesterday, where I went to PT and I told everything to my PT and lost it and got very, very scared.
I had physical therapy today, and my PT seems to be conservative about it. He's not super freaked out about my pain. He says that he thinks that maybe because of the traveling, because I've been traveling and it's also very cold and I've been sitting a lot and I haven't really been sitting in places that are very comfortable. He thinks that that might have irritated the hip. So he is thinking that we should give it a week for it to calm down and then reassess. Coincidentally, that week would be the day of my 8-month post-op appointment with my surgeon, so I guess that's very convenient in theory, which I don't know how to feel about. Of course, it's definitely convenient, but at the same time, like in the 4th month post-op appointment, this time I wanted to talk about going back to sports, and I am not super sure what this discussion is gonna look like. I've been telling myself that this might be tendonitis, but my PT says that given my history and my anatomy, it's really likely that it's the labrum that's upset, that the labrum shows or expresses itself in different ways. The symptoms are usually not the same. Because I was telling him, I'm like, I've had this before. Like my right hip has gone through this before, and I cannot believe that for the life of me I can recognize if these symptoms that I'm feeling, like if this pain that I'm feeling in the other hip is the same that I felt in the first hip. But he was telling me that symptoms can vary a lot, and I'm sure that if you are watching this and you have this condition, you know that symptoms can present in very weird ways. So I don't know. He asked me, my PT asked me not to go to this dark place. And I'm doing as much as I can not to, but it is certainly very difficult not to. Living one day at a time and hoping that the hip is gonna come down and we can move forward. I guess the other thing that I wanted to say is that my PT suggested to give my surgeon a heads up and send him a message telling him that this is happening because he might want to see some imagery or something, and I just sent the message, and it just breaks my heart to know that this has gotten too serious to the point that I need to tell my surgeon. I guess it becomes serious by having to tell the surgeon. Hi. I'm 2 days away from my 8-month post-op mark. By yesterday I completely lost it because I am very afraid. Like, I don't think I can find words to define the amount of fear that this brings to my heart. And I'm sure that if you're watching this, you might have the same condition and you might understand what thinking about a second round of this means, and it's definitely very scary. You know, like, I already went down the rabbit hole. I already picture myself with the crutches and going through all of this again, and I honestly don't think I can do this again. It's very scary, and it's just that, like, I am not trying to be dramatic. The thing is that it's been almost 7 days non-stop of pain, and I don't know how to feel, and I don't know what to make out of this. And you would think that if I had symptoms on the other hip, I could know exactly how this feels. Each of the limbs are different, and I don't know if this was the same pain that I used to have before. I also, in the past, for the first hip, the pain happened while I was exercising. This pain is just happening out of the blue because I've been sick, haven't been doing any exercise, which is even more frustrating. I don't even know where this is coming from. And today I think it's tendonitis because the pain is more on like the outside of the hip and it goes down to the knee. So I hope it is tendonitis. I really hope that it is something that's just like, I don't know, irritated for some spectacular reason. I hope that it's this virus that is making me feel just sore all over the body. I really don't know. I'm just very scared. I'm deeply concerned.
And here we are today. Again, as I'm saying, I wish this video was brighter because I do have to acknowledge all the amazing things that have happened. But it also feels like I'm hitting a wall, like I was running and I had my momentum and then just and now I'm like, what the heck? And I'm scared, I'm concerned, I don't know what's gonna happen. And everybody's asking me not to spiral and not to go to the dark place and to have positive thoughts. And all of that is valid, and I agree with that. However, it's difficult not to go down the spiral when you have pain that is there at every single freaking second. It's not that I'm in pain when I am exercising, or it's not that I'm in pain only when I'm walking. I'm in pain when I'm sitting, I'm in pain when I'm standing, I am in pain right now. So I'm super scared and I don't know what's gonna happen. And here I am, waiting. So this is month 8. I really hope that next video I can come to you and be like, you know what? Nothing is wrong and I was exaggerating. I'll take it. I don't care if I look bad. If that's the price I have to pay for this hip to be healed and for me to avoid going back to everything that I've gone through for the past year, I'll take it. Cross your fingers for me. I'll keep you posted. Thank you so much for watching till the end. Bye.
Before the end of the video and the end of today, just wanted to give you an update. I got an answer from the office of the surgeon, from his physician assistant, and she says that she agrees with my physical therapist that probably the pain comes from sitting for too long, that usually patients with impingement tend to feel like this. She said not to freak out about it yet, that there are solutions, probably this is just a temporary flare-up, and that we'll talk about it when I see the surgeon. So that, you have no idea how much relief those words brought to me. I am much more relieved. At the same time though, the pain was really bad tonight, and I even felt like a little bit of heat, like I don't know, it felt like I had fever or something, like in the hip area. So I don't know, that was really weird, but that's the update.